So hello to all of you. Am I audible? Yes. So we've got this plus subscription, something about Unacademy. We've got this plus subscription in which we have got this daily live classes, the structured courses, the live tests and quizzes, and unlimited access to the course materials. Iconic subscription we have, wherein you get the lectures of Unacademy and the notes of pre-platter. Iconic subscription. The prices are further slashed. This is a limited time offer. Just have a look at the website. 3 plus 1 month. 3 months, you get 1 month free course with this. Yes, we have started with the first year MBBS, the first prof from this Monday we have started. We are also starting with the second year professional and the third year professional batches. FMG test and analysis batch from 17th of May and target next from 19th of May. Season 1 NEET PG 21 images. 19th of May we are beginning this batch. We've got some 34,000 MCQs for you. Download the app and use the referral code. Right, so starting with today's topics, clinical anatomy. Okay, so welcome all of you. So clinical anatomy, some MCQs I'll be showing. Just try to understand and answer those. Okay, here we start. As you all know, I'm Dr. Pradeep Pawar, Professor of Anatomy. I've been teaching students since last 21 years. Okay, that's the first MCQ for you. Go through it, answer, then we discuss it. Good evening to all of you. Yes. What do you think is the answer? Yes, Ramesh. What do you think is the answer? Yes, very good. Very good to all of you. Yes, very good. So the answer is failed obliteration of the allantoic remnant. Failed obliteration. Have a look. I'll start with the MCQ. A male newborn is delivered at term to a 30-year-old woman. Pregnancy and delivery were uncomplicated. At birth, the umbilical cord is noted to be large. When the newborn cries, straw-colored fluid leaks from the umbilicus. The external genitals appears normal. Which of the following is most likely the cause of the symptom? So answer for this is failed obliteration of allantois or the urachus. Tell me, just answer whatever you know. So it will be an interactive session. Tell me, the urinary bladder is derived from what? Where is it derived from? Now you've got three guts. You've got foregut, you've got midgut, you've got hindgut, right? So urinary bladder is derived from which part of the gut? If you can answer this, the urinary bladder. Yes. Answer. Urinary bladder is derived from which part of the gut? I'm asking. Yes. Answer whatever you know. It is derived from the hindgut. Hindgut, yes, it is endodermal in origin. The urinary bladder is derived from the hindgut. The part of the hindgut, and there's a comma-shaped structure here. See this? What is this comma-shaped structure known as? This is what we call as the urachus or allantois. So urinary bladder is derived from the hindgut, and the part of the hindgut below the attachment of allantois, that is known as the cloaca. And this cloaca is divided by a septum. What do you call this septum as? Just one moment. I'll draw this for you. Have a look. Yeah. So that's the hindgut here. This is the hindgut. And this is the allantois here. The part of the hindgut below the attachment of allantois. Now this part below the attachment of allantois, this part of the hindgut is known as the cloaca. Okay, so cloaca is a part of the hindgut below the attachment of allantois, and at the junction of the allantois with the hindgut, you get a septum here. What is this septum known as? This is what we call as the urorectal septum. And this urorectal septum is going to divide this cloaca into two parts. This is what we call as the urogenital sinus, and this is going to form the rectum and anal canal. Okay, so the urorectal septum, this is the urorectal septum, divides the cloaca into a urogenital sinus anteriorly and a rectum and anal canal posteriorly. And this urinary bladder is communicating with the umbilicus through urachus or the allantois. Fine. After birth, that means the entire bladder is endodermal in origin except a small area on its posterior wall. What is that? That is the trigone, yes, which is derived from the absorbed mesonephric duct, and that is mesodermal in origin, right? So the entire bladder is endodermal in origin except the trigone, which is derived from mesoderm, from the absorbed mesonephric ducts. Excellent. So now to begin with, the urinary bladder is going to communicate with the umbilicus through this urachus or allantois, right? After birth, what happens to this allantois? After birth, this allantois degenerates off, okay, it obliterates off, and in us now there's a ligament which extends from the apex of the bladder to the umbilicus, and this is what we call as the median umbilical ligament, right? Median umbilical ligament. So what is median umbilical ligament? It is the obliterated urachus or allantois. If it does not obliterate, the child will be passing urine through the umbilicus, and this is what we call as the weeping umbilicus. Weeping umbilicus, it is also known as the urinary fistula. Okay, weeping umbilicus or the urinary fistula. Is this clear? Right. So now look at this slide and tell me now, what is this view of the abdomen? Okay, where are we looking this from? This is the anterior abdominal wall. You're looking from inside the abdomen. Anterior abdominal wall from inside the abdomen. This is the urinary bladder for you. That's the urinary bladder. And what is this? This is the median umbilical ligament. Median umbilical ligament. This is the anterior wall of the abdomen. We're looking from inside the abdomen. And this is the median umbilical ligament. Okay, if it does not obliterate, the child will be passing this urine through the umbilicus. That is known as weeping umbilicus. Okay, what is this on either sides? This is what we call as the medial umbilical ligament, and this medial umbilical ligament is, if you can answer this, what is this medial umbilical ligament? It is the answer medial umbilical ligament. That's the obliterated, yes, obliterated umbilical artery. Yes, that's the obliterated umbilical artery. Now, the umbilical arteries begins from the internal iliac in the pelvis, and they're going up towards the umbilicus, right? They begin from the internal iliac and they're going up towards the umbilicus. As they're going up towards the umbilicus, on the way comes the urinary bladder. So one artery goes from this side, one artery goes from this side. And this is how both the umbilical arteries would go towards the umbilicus on either sides of the urinary bladder. After birth, this part of the umbilical artery from the bladder to the umbilicus obliterates off, and this is what we call as the medial umbilical ligament. Okay, so medial umbilical ligament is the obliterated umbilical artery. And the non-obliterated part of umbilical artery, it now extends from the internal iliac to the bladder. It is now known as the, yes, what is that? From the internal iliac to the bladder, and this is the non-obliterated part of umbilical artery, and this is what we call as, answer, this is what we call as now the, yes, what is it now known as? The superior vesicle artery. Okay, so superior vesicle artery is the non-obliterated part of umbilical artery. Superior vesicle artery, that's a non-obliterated part of umbilical artery. Okay, clear to all of you? Just see this MCQ once again. So answer for this is failed obliteration of the allantoic remnant. Failed obliteration of the allantoic remnant. Okay. Now, what is this vitelline duct? Tell me, what is this vitelline duct? Also known as the Vitillo-intestinal duct. Okay. Vitelline duct or the Vitillo-intestinal duct. Look at this. In fetal life, the midgut communicates with the umbilicus through, that's the midgut, and the midgut is going to communicate with the umbilicus through, this is what we call as the vitelline duct or the Vitillo-intestinal duct. The midgut communicates with the umbilicus through the vitelline duct. After birth, this gets obliterated. The vitelline duct is obliterated. If it persists, there will be a communication from the midgut to the umbilicus. And this is what we call as, answer this, what is this known as? If this vitelline duct remains persistent, what is that known as? A communication between the midgut and the umbilicus. And this, no, it's not Meckel's diverticulum, Shahrukh. No. This is what we call as the fecal fistula. Fecal fistula. If the entire vitelline duct remains persistent, the child will be passing feces through the umbilicus, and this is what we call as a fecal fistula. You understanding? But most of the time, what happens is, the distal part of the vitelline duct, the distal part obliterates off. This part, the distal part is gone, and the proximal part of the vitelline duct remains persistent. Yes, and the persistent proximal part of the vitelline duct is now known as Meckel's diverticulum. Okay, that's the persistent proximal part of the vitelline duct. If the entire vitelline duct remains persistent, that is a fecal fistula or a, fecal fistula. Right, clear to all of you? Just one more option which was left here. I'll just finish that option for you. Yes. Fine, that Meckel's diverticulum must be knowing. Tell me now, abnormal fusion of the urethral folds. Now, what are these urethral folds? Now, the external genitals are mesodermal in origin. The external genitals I'm talking about. I'm not talking about the testis and the ovary. The gonads are derived from intermediate plate mesoderm, and this external genitals are also mesodermal in origin. This is the genital tubercle, this is the genital tubercle, this is the genital swellings, and that's the genital folds. Okay, the genital tubercle is going to form what? It forms the penis or the clitoris. Penis in males, clitoris in females. The genital swellings, this is going to form what? The scrotum and the labia majora. And the genital or the urethral folds, this is going to form the labia minora or the ventral aspect of the penis. And if this urethral folds does not fuse, if they do not fuse properly, there will be an opening, the urethral opening on the ventral aspect of the penis, and this is what we call as, answer this, if this urethral folds do not close properly, the urethra will open on the ventral aspect of the penis, and this is what we call as, yes, answer. The urethra opening on the ventral aspect, that is known as, yes, answer. Samyukta, what is that? Hypospadias. Yes, Shahrukh, that is hypospadias. Right, that is hypospadias. So, yes, that's hypospadias. Very good. So that was the option. Abnormal fusion of the urethral folds. That's the urethral folds or the genital folds. If they do not fuse properly, the urethra will open on the ventral aspect, and that is what we call as the hypospadias. Is this clear to all of you? This MCQ is clear? Understood? Yes? Right? Okay. We go to the second MCQ. Look at this MCQ and answer. I've just put 3 MCQs for you for today's discussion. So we'll take 15 minutes per MCQ. You think you answer, we'll discuss in details the options and the MCQ. Okay. Yes, Sahil. Good. Yes, the rest of you, fine. Proceed to the next MCQ. Thank you, my child. Okay. Thank you. So what do you think? What is the answer for this? One of the following is true. Yes, 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 my dear children, you are so nice. Awesome. Answering very well. The concept should be clear. Look, the clinical part can be put in any different way. Any permutation combination is possible, but the anatomy is not going to change, right? Very nice. Excellent to all of you. Have a look. A 50 years old male comes to the clinic with loss of taste sensations. On examination, sensations were not felt on the posterior 1/3 of the tongue. So posterior 1/3 of the tongue immediately comes to my mind is the glossopharyngeal nerve, right? Glossopharyngeal nerve, both general and special sensations. Yes, lesion of the glossopharyngeal nerve was suspected. One of the following statements about this nerve is true. See, the first option supplies the stylopharyngeus muscle. What do you say? Glossopharyngeal nerve is a nerve which pharyngeal arch? Answer this. Glossopharyngeal nerve is a nerve which pharyngeal arch? Chalo, answer. It's just a revision for you, a rapid revision. Glossopharyngeal nerve is a nerve which pharyngeal arch? Third pharyngeal arch. And there's only one muscle in the third arch. There's only one muscle in the third arch, and that is the stylopharyngeus. So yes, the glossopharyngeal nerve supplies the stylopharyngeus muscle. This is correct. Glossopharyngeal nerve supplies the stylopharyngeus muscle. Tell me, glossopharyngeal nerve supplies the stylopharyngeus, right? And what is the name of the nucleus of the glossopharyngeal nerve in the brainstem, which is going to supply the stylopharyngeus muscle? Like, see, just wait, 1 moment. Glossopharyngeal nerve supplies the stylopharyngeus muscle. That's a muscle of the third arch. Glossopharyngeal nerve supplies the tongue, right? Glossopharyngeal nerve supplies the parotid gland also. That means glossopharyngeal nerve will not have only one single nucleus. This is true for any nerve. All the nerves will have many different nuclei. Okay, many different nucleus. Like one nucleus will supply the parotid gland, one nucleus will supply the tongue, one nucleus is going to supply the stylopharyngeus muscle, right? So this glossopharyngeal nerve will have many different nuclei, and all this nucleus you are supposed to know. Okay, this is very important. So what I'm asking is, what is the name of the nucleus of the glossopharyngeal nerve which is going to supply the stylopharyngeus muscle? Answer. I hope you've got the question. Yes, my dear children? No, I'm not asking about the functional component, my child, Prathamesh. I'm not asking about the functional component. I'm asking you the name of the nucleus. And functional component is not general somatic efferent. It is, I'll tell you, you answer. If I give you a hint, you will be answering it immediately. General visceral efferent. Okay, the component is general visceral efferent. I want the name of the nucleus. Just tell me the name of the nucleus. I'll give you a hint. Wait. I'll give you a hint. This nucleus is common for... there's a common nucleus for 3 nerves. Can you guess this? There's a common nucleus for 3 nerves. And all these 3 nerves are supplying the muscles of the pharyngeal arches. Yes, you got this, Sonalika. Yes, you got this. It is not NTS, sorry. It is not NTS. Yes, Shruti, you're right. That is not nucleus of tractus solitarius. No, it is the nucleus ambiguous. Nucleus of tractus solitarius is a sensory nucleus. We'll come to that. It is a nucleus ambiguous, and this nucleus ambiguous is a motor nucleus, right? It's a motor nucleus, and it is a common nucleus for 3 cranial nerves: the 9th, the 10th, and the cranial accessory. And that is how, yes, very good. And that is how the 9th nerve supplies the stylopharyngeus muscle through this fibers from this nucleus, right? The 10th and the 11th would supply the muscles of the 4th and 6th arch through this nucleus. And that is the nucleus ambiguous. Okay, so that is the nucleus ambiguous. You're able to understand this now? So this is the nucleus ambiguous. I'll just write it down for you. Okay, that's the nucleus ambiguous. That's the nucleus of glossopharyngeal nerve. And which functional component? Okay, my child. I'll arrange a lecture on functional component. Hare Krishna. Okay, so what is the name of the component? Okay, I'll tell you some things here. Hare Krishna. What is the name of the component which is going to supply the muscles of the pharyngeal arches? What is the name of that functional component which is going to supply the muscles of the pharyngeal arches? It is special visceral efferent. Special visceral efferent. Okay, special visceral efferent, or it is also known as the branchiomotor component. Branchiomotor component, or the special visceral efferent component. And this component is going to supply the muscles of the pharyngeal arches. That is for the muscles of the pharyngeal arches. For the 9th, 10th and cranial accessory, the nucleus is nucleus ambiguous. So first nucleus of glossopharyngeal nerve is going to be nucleus ambiguous. Okay. Fine. What else does the glossopharyngeal nerve supply? The glossopharyngeal nerve supplies the parotid gland, right? It supplies the parotid gland. And to supply the parotid gland, it should have another nucleus. It should have another nucleus to supply the parotid gland. And if you can just tell me, what is the name of the nucleus of the glossopharyngeal nerve in the brainstem to supply the parotid? Yes, what is the name of the nucleus of the glossopharyngeal nerve in the brainstem to supply the parotid? Excellent, very good. And this is the inferior salivatory nucleus. That's very nice. That's the inferior salivatory nucleus. Get oriented like this. Otic ganglion is a ganglion, my child. Okay, Sonalika, that's a ganglion. The name of the nucleus is inferior salivatory nucleus. And what is the name of the component which is going to supply the glands? What is the name of the component which is going to supply the glands? It is the general visceral efferent. General visceral efferent. So it supplies the glands. Okay. The general visceral efferent component is going to supply the glands. And what is the name of the nucleus of the glossopharyngeal nerve? The inferior salivatory nucleus. Inferior salivatory nucleus. Yes, superior salivatory is of the 7th nerve. Very good, Shipra. Superior salivatory and the lacrimatory nucleus, that's of the 7th nerve. Okay, fine. Just one more thing I'll tell you. What else is the glossopharyngeal nerve supply? The glossopharyngeal nerve also supplies the tongue, which the posterior 1/3 of the tongue. That means it is carrying sensations from the posterior 1/3 of the tongue. And what is the common nucleus for the tongue? So anterior 2/3, what sensation? Who carries the sensation? Facial nerve. Posterior 1/3, who carries special sensation? Glossopharyngeal nerve. And posterior most part of the tongue, who carries the special sensation? Vagus. And there's a common nucleus for the 7th, the 9th and the 10th cranial nerve. Yes, very good. And what is this? This is the nucleus of tractus solitarius. Nucleus of tractus solitarius. Excellent. So this nucleus of tractus solitarius is a common nucleus, but this is an afferent nucleus. Remember, it's an afferent. It is getting sensations. And what is the name of the functional column? Special visceral afferent. Okay. So that is representing the special visceral afferent component. Now you're getting an idea about the nucleus, about the components. Yes, at least some idea are you going to get? Are you getting this? So this becomes the nucleus of the glossopharyngeal nerve. Okay, one is the nucleus ambiguous to supply the stylopharynges. Second is the inferior salivatory nucleus to supply the parotid. The nucleus of tractus solitarius to receive sensations from the posterior 1/3 of the tongue. Okay, so the glossopharyngeal nerve, look, this is so nice. Some fibers will come from this nucleus, some from this nucleus, and some from this nucleus, and all the fibers will now converge to form the nerve. Okay, so all the fibers would now converge to form the nerve. Tell me, where is the glossopharyngeal nerve attached to the brain stem? Clear to all of you this much? Now tell me, where is the glossopharyngeal nerve attached to the brain stem? Just have a look. I'll put the slide here for you. Yes. What is the glossopharyngeal nerve attached to the brain stem? Yes, tell me. You must be knowing this, my dear children. You must be knowing this. Just think and tell me. Yes, it is attached to the medulla. Once again, tell me, what is this for the medulla? I'll just magnify this slightly for you. Okay, I'll just magnify this part. Okay. Yes, fine. I'll be doing that. What is this? This is the pyramid. This is the pyramid, right? What is this in the medulla? This part is the medulla, right? This part is the medulla. I've already started, Sile, the comprehensive course I've started. Yes. So this is the pyramids. This is the olives. This is an anterior view, my child. Shipra, this is an anterior view. Which view of the brainstem is this? Answer this. What is this view of the brainstem? Where are we looking this from? There are only two views. One is from front and one is from back. So what is this view of the brainstem? Answer. Answer first. Just be clear about this first and then we proceed. Where are we looking this from? This is from front. No, this is a view from front. Why? Because all the cranial nerves are arising from ventral or the anterior aspect of the brainstem. Anterior view, ventral view. All the nerves are emerging from the anterior aspect or the ventral aspect of the brainstem, except there's only one nerve which is coming from the dorsal aspect. And what's that? Here. That's the trochlear nerve. Here, that's the trochlear nerve. That's the only nerve which is coming from the ventral aspect. So be clear about your concepts, right? So that is the ventral aspect. And now coming back, what is this? This is the pyramids. This is the olives, and lateral to the olives, what's that? That's the inferior cerebellar peduncle. Inferior cerebellar peduncle, pyramids, olives, and the inferior cerebellar peduncle. And these pyramids are formed by crossing of corticospinal tracts. The pyramids are caused by crossing of corticospinal tracts. The olives, who's deep to the olives here? Deep to the olives, if I go, I find a nucleus here. And this is the inferior olivary nucleus. And this inferior olivary nucleus will form an elevation outside. This is what we call as the olives, right? So this is the pyramids, yes. This is the olives, and that's the inferior cerebellar peduncle. Fine. So who's attached to the medulla? What is this nerve which is attached between the pyramids and the olives? Answer this. What is this nerve between the pyramids and the olives? That's the hypoglossal nerve. And between the olives and the inferior cerebellar peduncle, this is the 9th, the 10th, and the cranial accessory. Okay. So where is the glossopharyngeal nerve attached to the brainstem? It is attached between the olives and the inferior cerebellar peduncle. Between the olives and the inferior cerebellar peduncle, about the 10th and the 11th nerve. Okay, so that's about the glossopharyngeal nerve. Inferior olivary nucleus. It goes to the cerebellum, the olivocerebellar tracts. These are extrapyramidal tracts, my child. Shibra, these are extrapyramidal tracts, olivocerebellar tracts, vestibulocerebellar, olivocerebellar. Okay, this is for controlling the tone, muscle tone. Right, so that's the glossopharyngeal nerve. Okay, I'll proceed. I'll just tell you something else about the glossopharyngeal nerve. Tell me, which foramen does it get out from? Answer now, answer. Yes, which foramen does it get out from? The glossopharyngeal nerve gets out through which foramen of the skull? Yes, my dear children, answer fast. Glossopharyngeal nerve gets out through which foramen? Now you know the interior of cranium, you know the various foramens of the skull. It gets out through the jugular foramen, the middle compartment of jugular foramen. 9, 10, 11 cranial nerves. Okay, so it gets out through the jugular foramen. It's outside the skull now. The glossopharyngeal nerve is at the base of the skull. And now at the base of the skull, there's a pharynx. There are three muscles of the pharynx: the superior constrictor, the middle constrictor, and the inferior constrictor. And this glossopharyngeal nerve now enters the pharynx between, if you can answer this. Yes, the glossopharyngeal nerve now enters the pharynx between which constrictor muscles of the pharynx? This you should know. The glossopharyngeal nerve enters the pharynx between the superior and the middle constrictor of muscles of the pharynx, right? Between the superior and the middle constrictors, the glossopharyngeal nerve enters the pharynx along with the muscle which it supplies. The only muscle which the glossopharyngeal nerve supplies starts from the styloid process. That's the stylopharyngeus, right? So the glossopharyngeal nerve and the stylopharyngeus muscle enters the pharynx between the superior and the middle constrictor muscles of the pharynx, and then it gives branches inside, and then it goes to supply the tongue. That's the complete glossopharyngeal nerve for you. I've explained the complete glossopharyngeal nerve for you. Okay, right. I hope this is clear to all of you, right? See the MCQ once again. So one of the following statement about the glossopharyngeal nerve is one of the following statements about this nerve is true. Okay, answer now. 1. Supplies the stylopharyngeus muscle. That's correct. It is attached to the brainstem below the vagus nerve. What do you say? It is 9th, 10th and 11th. 9th, 10th and 11th. So it will be above the vagus, right? It's not below the vagus. So that's wrong. It is attached to the brainstem above the vagus. It's 9th, 10th and 11th nerves. Contains no special visceral afferent fibers. What do you say? Special visceral afferent. What are they going to supply? That's the nucleus of tractus solitarius. Special visceral afferent. That's taste sensations from the posterior 1/3 of the tongue. So that is wrong. It contains the special visceral afferent fibers. It contains. Okay. And what is the nucleus for that? The nucleus of tractus solitarius. The nucleus of tractus solitarius emerges from the brainstem between the pyramids and the olives. What do you say? It is between the olives and inferior cerebellar peduncle. It's between the olives and the inferior cerebellar peduncle, which is the nerve between the pyramids and the olives. That's the hypoglossal nerve. Hypoglossal nerve. So it's between the olives and the inferior cerebellar peduncle. Is this clear to all of you? Yes. Yes. Fine. Understanding this. Enjoying the session. Yes, all of you. Fine. I'll start with the last MCQ. Here, have a look. Answer this. Okay. Have a look. Understand this and answer. So this is clinical MCQ discussion that I'm taking. I've taken a lecture on functional components of the nucleus. Who was asking me this? Sonalika. I've taken a lecture on parasympathetic ganglions of head and neck. That's on YouTube. Parasympathetic ganglions of head and neck. Just have a look at that. So you'll get the idea of about all the the cranial nerves supplying the glands and all, and the ganglions, the relations of the ganglions, structural, functional relation. Everything I've put there on the lecture, in the lecture. So what do you say is the answer? Okay, I'll start with the MCQ. Just have a look. A 23 years old man comes to the emergency department complaining that he has a foot stuck in his throat. His symptoms starts 2 hours ago after eating a fish at a local seafood restaurant. He tried coughing and swallowing multiple in an attempt to clear the food, but so far he's been unsuccessful. Patient denies any difficulty in breathing. He does not appear to be in distress on physical examination. Laryngoscopy revealed a fish bone lodged in the left pyriform recess. Tell me, where is the pyriform fossa? Where is the pyriform fossa? All of you are answering this as C, no? Just wait now. Understand the stem of the MCQ. Where is the pyriform fossa? What is the pyriform fossa? Let us first discuss this and then we come back to the MCQ. Have a look at this slide. Look, this is a better slide to understand. Tell me now, or you see this, right? What are these folds? You tell me. What are these folds? Yes. What are these folds? Answer this. What are these folds? Answer. I pointed something for you. What are these folds? These are the aryepiglottic folds. Very good. That's the aryepiglottic folds. This structure is the larynx. But what are these folds? These are the aryepiglottic folds. So on either sides, you've got the aryepiglottic folds. And who's in front? Anterior and lateral. Who's that? What is the boundary of pyriform fossa? Look, this is the pyriform fossa. Like this space is the pyriform fossa. Inside, that's the pyriform fossa. So on either sides is the aryepiglottic folds. And who's the anterior and lateral boundary? If you can answer that, who's going to form the anterior and the lateral boundary? Not epiglottis, my child. No, not epiglottis. Who's going to form the anterior and lateral boundary? The thyroid cartilage. The thyroid cartilage and the thyroid membrane. Thyroid membrane and the thyroid cartilage are going to form the anterior and lateral boundaries. On either sides are the aryepiglottic folds, and between them, that fossa is known as the pyriform fossa. Pyriform fossa. Just have a look at the slide. I'll magnify this for you. Look at this slide. So what is this here? What is this? Look, what is this structure that I'm showing you? That's the thyroid cartilage. Thyroid cartilage on either sides here, thyroid cartilage. And what are these folds here? These are the aryepiglottic folds. Okay, these are the aryepiglottic folds. Aryepiglottic folds and the thyroid cartilage. Yes, between them is the pyriform fossa. Between the pyriform fossa. Between the thyroid and the larynx, that's also fine. So pyriform fossa, you've got the thyroid cartilage and the thyrohyoid membrane. Thyroid cartilage and the thyroid membrane. And if you can tell me what is the structure, just have a look at this. Look at this slide and tell me, that's the thyroid cartilage, that's the hyoid bone, that's the thyrohyoid membrane. And what is the structure which pierces the thyrohyoid membrane? Answer this. Thyroid cartilage, thyroid membrane. This you're looking from outside. This you're looking from outside. If I go inside this, that will be the pyriform fossa. If I go inside this, that will be the pyriform fossa. So who's going to pierce the thyrohyoid membrane? Excellent. That's the internal laryngeal nerve and the superior laryngeal vessels. Very good. Excellent. The internal laryngeal nerve, it's not superior laryngeal, my child. Superior laryngeal first only divides into an external and internal laryngeal, right? The external laryngeal nerve supplies the cricothyroid. So who's left? The internal laryngeal nerve. And the internal laryngeal nerve is going to pierce the thyroid membrane, and this internal laryngeal nerve comes to lie in the pyriform fossa. Understanding? Along with the superior laryngeal vessels. Are you getting an orientation? So that would be the internal laryngeal nerve. Okay, so now coming back to the MCQ, have a look. Laryngoscopy reveals, Laryngoscopy reveals a fish lost in the left pyriform recess. During an attempt to retrieve the fish bone, a nerve is injured deep to the mucosa overlying the recess. Yes, now clear what is the nerve? Yes, the answer for this is going to be the internal laryngeal nerve. Answer for this is going to be the internal laryngeal nerve. Internal laryngeal nerve. Internal laryngeal nerve. Yes, that means internal laryngeal nerve is injured. Yes, internal laryngeal nerve is injured. Smuggler's fossa. Yes, so the best answer here would be what? Answer would be cuff reflex. Which of the following is most likely to be impaired in this patient? Even though taste sensations will be lost in the posterior most part of the tongue, but the first answer would be cuff reflex. Which of the following is most likely to be impaired? Because cuff reflex, that afferent is carried by internal laryngeal nerve. Afferent is carried by internal laryngeal nerve to the medulla, and the efferents are again carried by the vagus, and they are also given to the phrenic nerve and the intercostal muscles, and that's how we start to cuff. So the afferent is taken by the internal laryngeal nerve. Yes, tell me, gag reflex. Who's the afferent for gag reflex? Afferent. Who's the afferent for the gag reflex? Okay, that's fine. That's not a problem, my child. Who's the afferent for gag reflex? It's not 12th nerve. Gag reflex afferent is glossopharyngeal nerve. Yes, it's the glossopharyngeal nerve for gag reflex, and the efferent is vagus. But if the afferent itself is damaged, then where will the efferents come from? You understand, no? So afferent is the glossopharyngeal nerve. Mastication, all the muscles of the mastication are supplied by whom? Muscles of mastication are derived from the first pharyngeal arch. So the nerve is, muscles of mastication are derived from the first pharyngeal arch. The nerve is mandibular nerve. Even if you write taste sensation, that's also fine. Taste sensation, the posterior most part of the tongue, the taste sensation. Ideally, the question should have been taste sensation in posterior 1/3. So then it becomes very specific. Okay, suppose taste sensation in the posterior 1/3 of the tongue, then your best answer would then your answer has to be cuff reflex. Okay, that part is missing. Taste sensation in the posterior most part of the tongue is carried by internal laryngeal nerve. Is this clear to all of you? The boundaries of pyriform fossa, the thyroid cartilage and the thyroid membrane, and on either sides is the aryepiglottic folds. In between them, you've got this fossa, which is known as the pyriform fossa. Yes. This is clear, no? This is the pyriform fossa here. This is the pyriform fossa. And if you look from inside here, which is this nerve now? If I draw something here, which is this nerve which is coming inside the pyriform fossa after it pierces the thyroid membrane? That's the superior laryngeal vessels and the internal laryngeal nerve. And this internal laryngeal nerve is damaged. What will be lost? The cuff reflex. Cuff reflex afferent is by the internal laryngeal nerve. It takes the sensations to the medulla, and the efferents is carried by the vagus, the phrenic nerve, and the intercostal muscles, which helps in cuffing. That's the cuff reflex. Okay, clear to all of you? So that's the pyriform fossa. Okay, just see this. This is what I was telling you. Tell me something. Sorry, something I'll show you in the slide. Right. So tell me, what is this structure that I'm showing? This is what I was trying to tell some days back, but I didn't have the slide for that. Yeah. What is this structure? Don't read anything. This is the pterygoid plate. That's the pterygoid plate here, and that's the mandible here. So what's this? This was an AIMS visual some years back. This was pointed. Yes, my child, tell me fast. What is this? From the pterygoid plate to the mandible. This is the pterygomandibular raphe. Styloid process is this, no? Yes, styloid process. This is the styloid process. This is the pterygomandibular raphe. This is what I was trying to tell you some days back. And this pterygomandibular raphe is very important because it gives origin to a muscle in front and it gives origin to a muscle behind it. The muscle in front, yes, who's this? The muscle in front is the buccinator muscle, buccinator, and the muscle behind is the superior constrictor muscle of the pharynx. Is this clear to all of you? So that's the superior constrictor muscle of the pharynx, and that's the buccinator. The nerve supply in front and behind the pterygomandibular raphe is different. If you can tell me, the nerve supply in front is by whom? In front of the pterygomandibular raphe. In other words, who's supplying the buccinator? The facial nerve, facial. And who's supplying the superior constrictor? Who's supplying the superior constrictor? The vago-accessory complex or the pharyngeal plexus. Pharyngeal plexus or the vago-accessory complex. This is clear? Are you all following this? So that's the superior constrictor muscle of the pharynx. That's the middle constrictor, and that's the inferior constrictor. And what is passing between the superior and the middle constrictors, which I just told you, this would be the stylopharyngeus muscle. Along with the stylopharyngeus muscle goes the glossopharyngeal nerve. Glossopharyngeal nerve along with the stylopharyngeus muscle. This will enter between the superior and the middle constrictor muscles of the pharynx. Yes. Okay. Okay, fine to all of you. That it is very nice. See, it all depends on how you understand it and how it is being taught. Understood? No? Boom. Boom Shankar. Yes. This Unacademy in this YouTube lectures, otherwise normally I take the polls and all. Clear? So this was a yes. So slowly I've started with this MCQs clinical discussion. Okay, in the morning we have this NEET MCQ discussion for the NEET 2021 clinical MCQ discussion. In the afternoon we have got this FMG at MCQs for FMG at 12 o'clock. Discussion for FMG students at 12 o'clock. Okay, and the evening we've started with the first prof. Now I've started with the first prof lectures. Okay, first prof lectures in the evening on alternate days. So you can tell your friends also. It's in the evening, spread over a period of 6 to 8 months. Mornings 9 o'clock. It is Thursday, Friday, Saturday, Sunday. 9 o'clock the NEET PG discussion. 12 o'clock is the FMG discussion. Everything is there on the website. You can just have a look at the website. Or you can have a look at my dashboard. Yes. Clear to all of you. So I've told you all this. Once again, something about our courses that we have. Yes, this is a plus subscription that we have, in which you have daily live classes, the test, the structured courses, and the unlimited access. We have got an iconic subscription. We have got the best of Unacademy and the best of pre-platter. The limited time offer, in which the prices are further slashed. Just have a look at this on the website. 3+1 month offer, in which you get the 3 months and 1 month free course. Okay. Yes. We've got this MBBS foundation for the professional batch 2 we have started, and batch 3 we have started, the FMG test and analysis batch, and the target next 2022. This is the season 1 PG NEET for images revision batches, 34,000 MCQs, curated MCQs for all of you, and download the Unacademy app. We've also started with this first prof. Okay, I hope everything is clear, and thank you to all of you. Such a wonderful lecture. It was a very interactive lecture. Thank you. Thank you. I'm starting slowly with all the courses. Okay, thank you to all of you. Thank you to all of you.